when you're not speaking, so it will be easier for everyone to hear the presenters. And I've also been told that when videos are playing, if you actually stop your video from playing on your end, so we just see your picture instead of you, that it might come through a little bit smoother, the sound. And at the end of the meeting, we're going to be having a prize giveaway questions and answers section. Questions are going to be based on today, on the things that the presenters are saying. So you want to pay attention as we go through. And then when you are asked the questions at the end, you're going to quickly type your answer into the chat box. And that's how we'll award you the special prize. And there will be 6 different chances to win today. And now I would like to introduce Dr. Seth Bernstein, the Executive Vice President of Community Investments at the United Way of Palm Beach County, and our very own Wellness Task Force Community Chair. Seth?
Thank you so much, Allison. Thank you, Paula. I am so excited to be here today. This is going to be a very fun-filled and rich conversation that we'll have today with lots of presentations. So we are just very excited that you all are here. If you wouldn't mind, please standing for the Pledge of Allegiance, courtesy of Bach Middle School of the Arts students.
Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much to our wonderful students to put that together for us. And then the next part is one of my favorite parts, right? Paul and Allison and others, is to read our purpose of the Wellness Promotion Task Force. After a number of years, we have been doing this. It's just a pleasure to be here with everybody. So as a reminder, the purpose is to create an educational forum that allows students, staff, parents, community partners, and members of the public to successfully collaborate in the promotion of healthier lives. With the district's ultimate goal of improving student performance, the direction of the Wellness Promotion Task Force is to encourage a proactive approach to holistically address the health, wellness, and safety of all school children and staff. So with that in mind, we'll start the meeting, and back to you, Allison.
Thank you, Seth. Dr. Fenoy, our wonderful superintendent, was not able to be here today in person, but he did pre-record something for us. So Paula, if you want to play that.
Good morning, and thank you for joining us for the district's first Wellness Promotion Task Force virtual meeting. The focus is all hands on deck, stronger together, including wellness during COVID. I'm proud that our district is committed to providing an environment that encourages the development of lifelong wellness practices among students, parents, employees, and the community. The Wellness Promotion Task Force plays a vital role in this effort, inspiring everyone to work together. The district's wellness promotion policy and this task force have created a wellness movement for the past 16 years. This task force consists of both internal and external stakeholders who are working successfully together to create a whole school, whole community, whole child culture. It is critical that children are given the support they need to reach their full potential. We accomplish this by coordinating policies, processes, and practices that nurture the whole child. Our collective focus on wellness promotes the overall well-being of students and helps raise academic achievement. We are all in this together to ensure that all 10 components of the whole child model are essential pieces of the entire puzzle, impacting all staff, students, families, and the community. To the wellness team, thank you for your commitment to our students and your family. I hope you enjoy your day.
So I just want to thank Dr. Fenoy for taping that. I know he's not here to hear this right now, but just to know that he's leading us in this initiative. He just like superintendents throughout the nation, have had a very, very challenging year, along with everyone, of course, but the decisions that he's had to make for our students and staff have been very challenging. And I know wellness and our health and safety has always been in the forefront of his mind, and of course ours as well. So now I would like to introduce Kristen Rulison, our Social Emotional Learning, SEL, manager, who will lead us through a special welcoming ritual. Kristen?
Good morning, everyone. A welcoming ritual is one of our social emotional learning signature practices. And the purpose of doing this is it really creates a climate of inclusion, belonging, and connection. There's different types of welcoming ritual. It could be a community building prompt where people get to know each other better, a prompt that matches the purpose of the meeting, or a check-in prompt. So for today's welcoming ritual, we're going to do a check-in prompt to really think about how we're feeling, practice a little social awareness, using our new district mood meter. So slide, please. So this slide shows our new district-wide mood meter. The mood meter is based upon Mark Brackett's work at Yale University. And what we've done is we introduced this mood meter to our secondary students in the fall, and we got such great feedback that, it was really a powerful tool that we have decided to create our own district one and create posters for schools so that they can use this as an anchor tool throughout the year. And we'll be introducing it to elementary next school year. So here's how it works. First, I want you to ask yourself, how energetic are you feeling right now in this moment? If you are feeling more low energy, then you are going to focus on the green and blue zones. If you are feeling more high energy, then you are going to focus on the red and purple zones or quadrants. So everyone ask yourself that question, and you should narrow it down to 2 quadrants. Now, the next thing you're going to ask yourself is, how pleasant are you feeling right now? If you are feeling pleasant, then you are going to narrow your 2 quadrants down to either the green or purple quadrant. And if you are feeling unpleasant, then you are going to pick either the blue or red quadrant. So now that you've identified the quadrant that best describes how you're feeling right now, I invite you to pick the word that best represents how you're feeling right now. And there might be a word that's not in that quadrant, and feel free to add that word. And if you can, in the chat box, just so we can kind of get an idea of how everyone's showing up today, if you could first put the color quadrant you're in, and then put the word, just so we can kind of see where everyone's energy and level of pleasantness is for today.
Well, if I knew what to do with this, I would.
Lots of purples. I see lots of people had their coffee or caffeine kick this morning. We got lots of greens. Relaxed. Well, thank you everyone for participating in our welcoming ritual. And I'm going to turn it back over to Paula now.
Thank you, Kristen. I definitely feel the purple color, and I feel definitely focused because I don't want to mess up this presentation. So I'm excited. Again, I want to just thank everyone who's here. Right now, we have 117 people logging in, and I'm hopeful that by the end of this, we'll have definitely almost a reach of 200 people. What I want to say is we really are a team. We are definitely working in concert to create the whole school, whole community, whole child effort. And one of the things that we did in FY20, prior to leaving with COVID, we did put a bulletin, a communication to all principals, that was February 26, 2020, for schools to complete a school assessment that it included 61 questions from all the 10 WIS components. And just before COVID, in the end of March, we had a total of almost 95% of the participation from the school for this assessment to be completed. We're very happy with that result. And our answers back to us is how we're going to see the benefits as we progress strategically in our wellness strategies with age component. So I know some of these components individuals are meeting individually to analyze deeper the results and see how we are going to move forward with either this coming FY22 or FY23 school assessment again. The next is that we have also been able to release our wellness promotion annual report. And because of COVID, we took advantage and we infused the FY19 and FY20 together. We unveiled it to the school board and our district administration in November 17, 2020. And we've been sharing it as much to all stakeholders in the community. One of the biggest assets of this report not shows the collaboration that we do with the School Health Advisory Council. And I do see Dr. Fishbane and also Seth, who lead this council, and we really want to participate and collaborate as a community with this. So I encourage everyone to peruse through this annual report, and we are going to start working on the FY21 by the end of May. There's going to be conversation in our next wellness promotion collaboration team meeting. Our next slide that I have is, our task force meetings are 3 a year. They're very well attended, and we're very excited to be able to see us eye to eye and hug each other. But because of COVID, we weren't unable to do that. And definitely one of our goals was we want to keep our community abreast, our internal stakeholders and our external stakeholders. So we took advantage to go into the creation of a newsletter. The newsletter, the first edition, was done on April 7, 2020, and we will be releasing edition 33 on April 7, 2021. And again, it's been definitely a really exciting opportunity to showcase our community members, our community events, and also showcase our WIS components throughout this newsletter, and really joining and collaborating together. It's been a really great addition. And we plan to continue to have a newsletter. However, in the beginning of FY22, which is July, instead of doing it bi-weekly, we're going to do it monthly. We started with every week. We went bi-weekly, and starting July 2021, we will do it monthly. The other exciting news that I can say is, we've been really asking our district and our school board the value of the whole school, whole community, whole child. And we've been knocking this door and this windows going through, and we are very excited to have the opportunity this year to work as a collaboration on the engagement team for the strategic planning for the coming few years. Thanks to Kathleen Villavicencio, under Attorney's Chief of Staff, we were invited to participate in the engagement steering committee, but also in the survey that has just come out on March 22nd, the phase 1 feedback survey that will be all the way till April 9th. They graciously also added one of the priorities for people to choose as expanding the whole school, whole community, whole child model efforts. And that is a great, great win. And we're just thrilled about that. All right, the next thing that I like to mention is the Let's Move campaign. Many of you have been moving your body in the month of March more than ever before. Certainly I have tried to do that, and I know our kids are doing that. So I really want to thank Palm Health Foundation and Digital Lives, Will and Vanessa, and everyone involved to really move us more in this community. With that, we were able to put a bulletin out to all principals and directors. We've done this in the past years. This bulletin went out on February 22nd, 21, and the action was until yesterday. I know they closed the site, so this is the last time I was able to look at the minutes logged in, but I'm pretty sure there's probably more than 40 million minutes captured. This also will be announced, the top 5 teams and the top 5 sub-teams will be announced at a party on April 16 that Palm Health Foundation and Digital Vibes will be delivering.
I called, I have 2 people, give me 1 second.
And I just want to say, if you haven't muted yourself, please do so. But anyway, we're excited to have this party, and we're excited. One thing about the sub teams and the schools competition is that this year, for the first year, they're doing a $500 grant for students, clubs, and as my last time I saw Belvedere Elementary and Omni Middle, and that was my only observation. So I'm really excited to see when they unveil the winners on April 16th. With that, we will start the presentation, and I'm passing it to Seth. There you go, Seth.
Great. Thank you so much, Paula. So just another shout out to Will and Digital Vibes. If you do not like them on social media, you are missing out on something really exciting. In his staff and the videos and the music that they do is just amazing. So give them a like on social media. Okay, so next up is a presentation, and I'd like to give a quick introduction to Dr. Lina Alonso. She's been with the health department since 1989, and she oversees one of the largest health departments in the state of Florida with over 700 employees. She describes herself as a public servant and a public health advocate, and is just amazing. She is also on our local healthcare district board and on Palm Health Foundation board, and so much other things that she does in the community in addition to her work. She does like snorkeling and scuba diving. I don't know, Dr. Alonso, if you've had opportunities this past year to do that, but maybe you'll share one of your own self-care tips perhaps with us. And if you saw in the chat box, her mood that she put was motivated and at ease. So with that, I give you our very own local Dr. Fauci. Dr. Alonso, you are up, and hopefully you can unmute yourself, and when you need the slide advance, just say the word slide and magically it will happen. Dr. Alonso, thank you so much for being here.
Okay, well, thank you so much. That's quite an introduction. No, I have not been able to scuba dive, but I have been in the water, and that keeps this Pisces happy. So yes. So let's start with this. We cannot talk about wellness without giving you a little bit of an update of what's going on with COVID. So let's go to the next slide. Who's running the slides?
I am, and I see the slide. I'm not sure why you can't see the slide, Dr.
There we go. There it is. Okay.
It took a little time. It's strange. I have 2 computers, and in the one in front of me, I can see it, but the little one, it wasn't. So I apologize. I think it's the bandwidth or something.
Oh, okay. Not a problem. Not a problem. We can take this slowly. No problem. So these are the numbers. You know, I could talk about numbers all day long, but I know that's really nerdy, but I've always been nerdy, so that's okay. I just want to give you a brief status of where we are. I'm very proud where Palm Beach County is. We are leading all the metropolitan counties in terms of the number of people that we have vaccinated over the age of 65, ahead of Broward and Dade, even though they have a lot more vaccine and they have a lot more federal sites helping them. We're doing it without any federal sites. We're doing, of course, the publics have been a tremendous help. By in the next 3 weeks, we should expect all pharmacies to have vaccine. The providers have finally been able to sign up now with Florida shots, and hopefully vaccine will be coming into the providers. That's going to be a tremendous help. And we have multiple missions coming into Palm Beach County. There are several happening today with state vaccine that's also helping us. So in addition to the vaccine, the little drib that we've got ourselves, we're also getting a lot of help because we've been very persistent with the state in getting to help us here in Palm Beach County. However, our total positive cases in Florida are over 2 million, and they have been going up instead of down. So that's concerning. We have 85,000 plus patients that have been hospitalized since the beginning of the pandemic. And in Florida, we have 33,425 deaths that have occurred as a result of COVID. And I know there's a lot of controversy, whether we're underreporting or over-reporting. And the fact is that way too many people have died with COVID, and everybody knows someone who has died of COVID. So I'm trying to stay away from the controversy and the political part of this and sticking with the numbers. In Palm Beach County, we now have 131,581 cases. They've gone up by 346. If you look over here on the columns where it says number of new cases, Palm Beach new cases per day, I can't point, so I hope you can see that it's in red. The 1, 2, 3, 4, 5, 6, 7th box over. Yes, there we are. You can see that our numbers have been, in the 300s. So we're running about 350 an average for the past 2 weeks. That is good. We have maintained that. They have not gone up. They have not gone down. We're way down from the 1,000 a day that we were doing in about a month ago. So we're very happy about that. That's a good thing. So you see the arrow going down on that box. For hospitalizations, we're at 6,504, and those hospitalizations have been steady. You see the first two arrows, the COVID hospital bed utilization is only 3.9%. That's about as low as it's been, and it's averaging that. And then the ICU beds is at about average of about 10%. That's also very good. And the hospitals are claiming that they are handling the cases well. We certainly know how to treat cases much better now. So our situation in the hospitals is good.
Way too
Next
complicated, De Niro.
I hit the next, it's going a little slow, so it's coming. There you go.
Okay. So the other thing that has us worried in the public health arena, the CDC, and the reason that people are talking about the fourth wave for Florida is that each time that we have gotten close to the curve going down, we start opening too soon. There are over 21, almost 30 states right now where the numbers are going up instead of down. That's very upsetting, right? And so now we have not only the three variants. Variants are normal mutations that occurs in viruses. That's one of the things that viruses are so prolific in being able to reproduce and go from person to person because they mutate just a little bit. And it's not a problem. The vaccine so far has been proven that because the vaccine has been done the way it's been done, which is really a new era of vaccinations with what they're doing now. It's just phenomenal. That because it's making antibodies against the protein that is surrounding the virus, that it is working on all these different mutations. So that is a very good thing. So we have the UK, which is the most prolific one. And as you can see on the right-hand column, Palm Beach County right now has 217 cases, Dade 320, and Broward 786. So Palm Beach County has not as much as Broward or Dade, but definitely we're up in that top 4 of the metros. Florida is the #1 state in the nation with the most variants. So that is very concerning. And the problem with the variant is we don't want that variant to become the most prominent virus. So we need to stop the spread. Now, these are not more lethal, but they are more contagious. They're easier to spread. So instead of spreading it to 1 or 2 people like the normal virus does, this virus will spread it to 4 or 5 people. So that is one of the reasons that people, again, are talking about this surge. However, I am staying cautiously optimistic because I think that we're vaccinating at such a high rate nationally and here in Florida, and especially in Palm Beach County and the Southeast Florida, where our hardest burden is of the virus, the largest burden, that we're vaccinating so quickly that we're going to be able to stop the spread by the vaccination. I am also extremely
Stayed up at night
optimistic about
worrying
the
about,
fact
what was the right decision? Did I make the right decision?
somebody's not muted. There we go. The fact that we just saw on the healthcare district dashboard that as they're making appointments, the young age, the over 18 through the 44, which are the people that are the most, they're the ones that are catching the virus the most, right? The elderly are staying home and being very careful. But that group has signed up to get the vaccine. So that tells me that yes, our group here in Palm Beach County is listening, they're paying attention to us, and they're following. So with that being said, as we talk about wellness, we have to think of the harmony, and this is, I'm talking to the choir definitely here, but in public health, we've always said it's the balance or the harmony of the mind, body, and soul. Next. And so we know that we have to stay in balance, and COVID has been one of the biggest disruptors of balance in everything that we do in society, from financial to emotional, and it certainly has taken a toll on our 8 dimensions of wellness. COVID has caused death. It has caused more fear than anything else. And it has taken a tremendous toll on isolation. And then we have the mistrust. All those things together completely unbalance the harmony that we have in terms of wellness. Next. So this was a poster done by one of the high school schools that emphasized the mental health issue. And I thought it was pretty good. I mean, the kids are worrying about grades. They have stress, anxiety, depression. They're thinking about college and high school and other kids. So we have seen a tremendous toll on children. And as the school district, that is one of your big emphasis, is how are the kids handling this? We even talked about them needing to come back to school to be able to socialize, right? So how do we find that harmony? How do we get back to the harmony? Well, we have to say we're all in this together. We've been saying this since the very beginning. We have to, take pride in our first responders, our nurses, and especially our teachers, especially in the school district. I mean, those to me are the heroes, the people out there in the front lines who keep going to work no matter what. There's new ways to connect. We don't have to be isolated. Look, I'm with all of you. I feel very connected to all of you, even though we're in an electronic form. We have found telemedicine is a new, the world is going to completely change with as a result of this pandemic. And we also have new ways to shop, dine, and play. So takeout is forever been changed. And just one of the problems of the vaccine is that everybody's so used to getting things in 24 hours from Amazon that the idea of having to wait for 1 or 2 weeks to get an appointment is absurd. So that is how much things have changed. So how has the school district mitigated this disruption? And these are all the different areas that I think that they kind of match up with our 8 dimensions of wellness. We've reached out to many community partners. Dr. Fenoy has been fantastic since day one, making sure that he had experts advising and putting together. The healthcare district and the health department have worked hand in hand to help and advise. the school had a choice. We opened with a choice of virtual and brick and mortar. Not all the schools have done this. You have seen schools that have remained closed for very long times. We have provided equipment, books, free lunches for kids that couldn't get lunches otherwise. We've been able to expand our internet. There's still spots in Palm Beach County without internet, but we've done a tremendous job in trying to mitigate that. We have maintained and followed the CDC guidelines, including the mask mandate that we have here in Palm Beach County. The school nurses testing and epi contact tracing has stopped the transmission. And I must say that I am very proud that we see that our transmission in school has not been at the schools, but coming into the schools from people failing to follow the protocols outside of the school area. We've maintained transparency with the dashboards that you guys created for the school, messaging, sending letters out. It's been, I really think the people have stayed updated. And of course, the Board of County Commissions prioritize vaccinating 65 and older with staff and students. We came out, we've done special events for the staff in contact with students. And now this weekend, there's going to be another team that's coming out, not just for the school district, but for the private schools also. So with all this, I just want to mention that the struggle is not over. We have to reach 70% vaccination in order to achieve the herd immunity. So please, everyone needs to have a plan. We need more vaccine and we need to meet the demand of what's the people are needing. So make a plan, share information at the grassroots level so that we can get more of the population to get informed, to be able to make an informed decision, and respect people's fears and choices about the vaccine. We can't force people to do this. They have to want to do it. And we need to continue aggressive, equitable distribution of the vaccine. That was from day one. I promised that we would distribute this vaccine in an equitable form, and we have. We have our maps showing the different areas, and we're still working on getting more vaccine east of 95 into specific groups. So wear a mask, wash your hands, watch your distance at all times. This isn't over until it's over.
Dr. Alonso, again, this is Paula. Thank you so much for your presentation. We do have the ability to ask, anyone can unmute themselves and ask no more than 2 questions. And then we have a special.
Paula? Yeah, we actually have a question in the chat, which I'll ask in a moment, but sorry to cut you off if you want to finish.
No problem. So we have a special guest right after the questions. One of our board members who has been extremely supportive is here to check in and say hello. So Dr. Alonso, this is your time for questions.
Shoot 'em at me. Go ahead. I'm ready.
All right. So Dr. Alonso, a question in the chat is, will folks who do not have a Florida ID be able to get vaccinated with the healthcare district or pharmacies? And so it's probably about, folks that are undocumented residents here in Palm Beach County is my guess. The person can clarify that, but is that an issue?
That should not be an issue. It is an issue for the person if they don't know how to do it. But there are multiple ways that we have taken care of undocumented people who don't have a license, for example. There are IDs that are available that are not licenses. There are also different groups, the doctor's offices, clinics, the Homeless Coalition have been doing IDs for people. There are letters that can be written from the clinic or from churches verifying that, yes, Alina Alonso lives at 735 Biscayne, and that we know her date of birth is March 8th, 19 whatever. And so there are many, many ways and many people that are willing to do that for folks who don't have but you have to have some kind of ID when you show up. You would have to give your name, your date of birth. We do not ask for social securities or your Medicaid or Medicare numbers. Those are not things that we ask for. We just have to identify and make sure that we're giving the vaccine to the right person with your date of birth as an identifier. That's all.
Fantastic. Thank you so much, Dr. Alonso. Also, another question is about students. Should students be forced to attend school in person? Not sure where you want to go with that, but what are your thoughts on that?
Well, you can't force anybody to do anything. I mean, we've known that, especially in school. The good thing that you've had in Palm Beach County is you've had that choice. And even the teachers have had, and I so commend anybody who can do virtual and virtual and in person at the same time. I don't know how the teachers do it, but I know they're doing it. So I think that your struggle and your extra efforts that you guys, that the whole district has made in order to giving people that choice is the reason you have so many people coming back, because now they feel safe. So you can't make anybody do anything until they feel safe. And you have done that. This district has gone above and beyond. The board, everybody has been so supportive in making sure that all our CDC guidelines are followed. There's new guidelines now that restrict you can lower it to 3 feet apart instead of 6 feet apart, but the other measures have to be in place, such as the mask, the washing, the sanitizing, and so forth. And the district has followed all those guidelines. So I commend this school district for being so attentive to all these rules. And I think that's what's made people trust and feel safer to come back.
Excellent. Thank you for that perspective. Yep, there's some other comments just about a passport being a valid ID for folks. And there's a question about whether there needs to be an address here in Palm Beach County verified. And Dr. Alonso, it sounded like even a letter from a physician or a church, or I don't know, maybe even a nonprofit organization that is serving that person with an address. Is that legit?
That is correct. And yes, passports are valid IDs everywhere that you go. A passport can be used. But yes, there's many ways. You just have to be, what we want to know is that when I get there, I want to make sure that I'm vaccinating Alina Alonso, because if I have to come back for the second vaccine, you're going to make sure it is me and that my date of birth matches, because those are two IDs that we utilize to match the name with the date of birth. There are many Alinas and there are many Alonsos, and so the date of birth and the address and so forth, those are ways that we can match to make sure it's the right person.
Wonderful. Well, Dr. Alonso, no more questions are coming in the chat. We so appreciate you taking the time with us today. You're amazing. You're steadfast for our community, and you're quite an advocate for all of us in Palm Beach County. And I hope that you stay motivated and at ease today and for the rest of the week. And we look forward to seeing you next time. Thank you so much, Dr. Alonso.
Thank you for having me. It's an honor.
Thank you, Dr. Alonso. We love you here.
Thank you.
Paula, back to you.
Thank you, Seth. And I know our time is a little delayed, but we're doing great. And I'd like to introduce our board member, Ms. Erica Whitfield. Erica, hi.
Hi, good morning, everyone.
Good morning, Erica.
Good morning. Well, thank you so much. First of all, let me say a quick thank you to Dr. Alonso's very kind words she said about the school board. Without her guidance, I don't think we could have gotten through this year. This has been crazy and tough and just, I mean, so I actually sent my child back to school on the very first day that we allowed children to go back in person, because I think we've never really realized how amazing teachers were. I always thought they were great until I had to be in charge of my own child's education. And I don't want to do it ever again, actually. If we can avoid that, that would be great. I'm just so grateful for the work that's been done at our school district by our teachers, our principals, our support staff. I mean, this year has been crazy. So I'm so glad that we are finally having a wellness promotion task force meeting again. And I can tell you guys how important the work is that what you guys are doing for our community. Yesterday, I had the opportunity to participate in our school board is working on an equity statement for all of us. And I think, there's never been a more important time for us as a board to discuss this. We spent the time going through and kind of trying to say what we value as a school district and how we can make education better. And the reason I bring this up to you today is because some of the things that we hit on are really important to the work that you do. We're talking about racial equity, figuring out how that we how we can start dismantling the systems that have been put in place for so long that make it a predictor of success within this district, what race you are. We also added in gender identity, sexual orientation, which are particularly important to me. I'm very glad to have those added in. We added in pieces about poverty and about documented status, if you are a citizen or not, and what that means for your predicting outcomes for your success within our school district. We added in pieces about whether or not you speak English, what your language status is, you know, how heavy your accent is. We know that these things all impact whether or not you do well in the school system. The other things we added in was the adults taking responsibility for emotional intelligence, social and emotional learning, and then the academic success of our kids. Academic mastery is the word we came to. So I say all of this because this equity piece that we're working on is so crucial to setting the direction that we want this school district to go in. And you all have a part to play in the work that you're doing, but also we are putting out information asking for help. You probably have seen surveys asking for help around the strategic plan. That's something that's very important to me. We only do it every 5 years. And so we're doing the equity statement first, and then we're going to move into our strategic planning process. And we've asked the community to come and actually give us feedback on what we think is the most important things that we should keep doing, stop doing, and then, you know, maybe move on from in some of these projects. So that's some of the things that we're asking you. We've sent out surveys. We're going to be doing focus groups. There's a steering committee. So we need the community to be with us on this strategic planning process. And I've been working a lot with Paula, talking about the WISC model, the whole child model that we have at the school district. And what I would like to do is have that part be part of what we do in our strategic planning, so that we are thinking about the whole child and all the parts that come with, you know, what the baggage that they bring to school and whether or not that makes them able to learn. So how do we as a school district deal with that? So I think there's a lot going on in the school district right now. Even if we're not able to be in person, your voices are extremely valuable and we need you. So I wanted to come this morning just to talk to you all about that. And I can answer any questions that you guys have for me. But most of all, I just want to say a huge thank you for everything that you've done in this past year during the pandemic, supporting our teachers, our schools, our students, our families, our parents. We couldn't do without you. And just one really quick big shout out to Allison and the School Food Service Department. You guys are you make my heart just happy with the way that you're feeding children throughout this whole time. You've really stepped it up, and you always are so amazing. But I don't know what we would do without you guys. So huge thank you to you all. But if you have any questions, please feel free to ask me. I'm here.
Erica, thank you for the shout out. My team is just amazing and I appreciate the recognition for them. Thank you.
Absolutely. I love you guys. Okay, well, if you guys don't have any questions, I'll let you get back on with the meeting. Unfortunately, I'm doing double duty right now. This is the other meeting I'm currently on. So, so I'm trying to do both. I'm multitasking the best of my ability this morning. So if you guys ever need me, please feel free to reach out. Send me an email, erica.whitfield@palmbeachschools.org, and I will get back to you about any questions that you have. And thank you again for supporting the school district. We really appreciate it.
Erica, if you want to go and put your address in the chat, that way people can see it as well. And thank you so much. I'm very excited that you were able to join us even in this way. So thank you so much. Have a great meeting, and we'll be talking, okay?
Great, thank you so much, everyone.
So now I'd like to introduce Kelly Sapp, who will be taking over. Kelly. Now, I don't know what happened to Kelly. Kristen, are you there? Oh, there's Kelly.
How's that? Is that better? Can you hear my voice?
Yeah.
Sorry, my earbuds decided to not work, which is just the way it goes. So my name is Kelly Sapp. I'm one of the members of the social emotional learning team here at Palm Beach County School District. And we're going to take a little bit of a wellness break. The Cleveland Clinic has done a little bit of research on eye strain and being able to attend fully while we are in either distance learning or virtual meetings such as this. What they have discovered is that for your best health and wellness, it is good and helpful to take a break approximately every minute. And to reduce eye strain, you can either close your eyes or look away about 20 feet in front of you. So that's what we're going to do for the next 20 seconds. I invite you to either close your eyes if that's comfortable for you, or choose a spot away from your screen that is 20 feet away, and you're going to pause for 20 seconds. And they recommend that you do this about every 20 minutes that you're looking at a screen. So let's begin. Take your time to either close your eyes or look away into the distance, at least 20 feet away, for 20 seconds. And I will prompt us to come back after the 20 is done. All right, welcome back. It's so interesting how quiet and peaceful 20 seconds can be for everybody. So I'm going to hand it back over to Paula, and I will be joining you shortly.
Hey, thank you, Kelly. I can't wait to have another rest. And it's so true. Definitely one of, everything, it's important. Our oral health is important, but with COVID, I realize how important our eyes are, and I agree. We need to step away from being in front of so much computers and just in a little silence. So next, it's the big part where we're going to do our WIS models part 1. We have 5 components, and we're going to start with teaching and learning, our component of physical education and physical activity. And I am going to give it to Eileen Tirado. Eileen, are you there?
Yes, good morning, everyone. I'm so excited to be here with everyone this morning. Thank you for having me. And on behalf of my physical education, health, driver education administrator, Eric Stern, I'm here to represent our physical education team. So as you know, our goal in physical education and physical activity is to promote physical activity and provide physical education with the intent of improving staff and students' health, academic achievement, and reducing childhood obesity. And one of the great fun ways that we have decided to do this during this year, and we're just making that 1-year mark, where we have since started our challenges throughout this year. So Palm Beach County Education Team has challenged the students, parents, communities, and the world to stay healthy. Our first challenge started about a year ago due to the cancellation of the Boston Marathon. And our version of the Boston Marathon was to complete 1 mile a day for 26 days. And then we would complete the final mile together as one community. Participants were able to be involved in a variety of inclusive ways, such as walking, jogging, biking, skating, rolling, paddling, or swimming. The success of these challenges came from families participating together, sharing their stories via social media. So I know that a lot of you were able to partake in some of our challenges throughout the year. You were able to share those pictures with your family members and the different activities that you participated in. And it just helped to bring more collaborative unity during this time of being so apart. Our second challenge that we were able to present was a triathlon challenge. This task was for families to participate in a variety of health-related fitness components, such as cardiorespiratory endurance, muscular strength, muscular endurance, and flexibility. And we were able to, the families, the children, the community were able to achieve a certificate that showed their participation. They enjoyed being able to see others, sharing their participation along the way. So it was really, really a great response from the community, from a lot of people within our school district, schools, and students. Next slide. Our third challenge was the summer tour. Families were challenged to increase their activity miles and visit virtual destinations and earn badges from around the world in an interactive summer tour map. So because a lot of families weren't able to take regular summer vacations, we thought it'd be a fun way to have virtual destinations for families to visit as they completed certain mileages around the world. So we saw a lot of families having fun with that throughout the summer. And our fourth challenge that we were able to give to the community was based off of the New York City Marathon, and it also included an interactive New York City map where everyone was able to earn badges and a finisher medal. What's great about any of these 4 challenges is that they can be completed at any time. Most of them were in a 30-day window, but you can also do it at your own leisure. And the most important thing is that everyone is keeping moving, staying active, and sharing that with others. So we just want to keep the health of everyone during this time. And now our next WIS component, Nutrition, Environment, and Services, will be presented by Allison Munblow.
Thank you, Eileen. So for Nutrition, Environment, and Services, our goal is to promote student and staff health through the operation of child nutrition programs, safe food practices, and the availability of healthy eating environments, school gardens, nutrition education, and promotional outreach, with the intention of improving student health, academic achievement, and reducing childhood obesity. Next slide. So way back in March 2020, we received notice that the schools were going to be closed and everyone was to remain home, but not the school food service staff, because we had a very important task to do. We reacted quickly and set up 29 grab-and-go sites, distribution sites, so that our students and parents could come and pick up meals. We began feeding them on March 16th, and that has not stopped throughout the entire year. As it became evident that we were going to be out longer than first expected, we had to change up. So we started with the 29 sites, we then moved to 35 sites and 51 sites and 133 sites. We were open on Monday, Wednesday, Friday, and then Tuesday, Thursday. And so it was just really a trial and error as we went through this. But you can see a picture there. That's one of our grab and go carts. Slide. So as soon as we realized the pandemic was lasting longer than anticipated, at first we thought this was going to be like a 2-week ordeal, and that certainly didn't happen. We reached out immediately to our community partners, because through our program, we can feed the kids. But we realized that as this continued to go on, that our families and community needed more than just the food that we were able to provide. So this picture here is actually from Feeding South Florida. They partnered with us and brought in their tractor trailer loads of boxes of food, and we were able to hand those food boxes out as the parents came through and picked up our meals. They also picked up a food box. Next slide. So I want to thank all of our community partners, because those all listed on the screen here really helped us and to get additional food out to our families. You can see in the end, we were able to provide 199,550 additional boxes of food to the families on top of the meals that we were providing. Next slide. So the school food service program is funded through the USDA, and we only receive our funds for the meals that we actually provide to students. So you can imagine what happened to our funding when all of a sudden nobody was in school. And yes, we were providing, like I said, at all those grab and go sites, but even at the top, we were only reaching maybe 20,000 students a day when we normally are feeding 100,000 students a day. So our funding was drastically being reduced, and we were still having to pay all of our expenses and our staff. So we reached out and to community partners, and we're very, very thankful for those on the list right here, because they came through for us and provided us with additional grant funding. Next slide. The grant funding was used for things like PPE, wireless scanners. We had ponchos for our staff. At the beginning, when we had our staff as first responders come back, when everybody was off, they were actually paid a disaster pay for those frontline workers. Fresh fruits and vegetables for the families. The county gave us a generous grant, which afforded us the opportunity to give even more food, other than what I had just mentioned, out to our families. In total, there was $3.2 million worth of grants that we were able to apply for and receive. Next slide. So then the time came to transition back to brick and mortar. So we were doing the distance learning and going back to brick and mortar. We realized that we needed to do something to make sure that the students were receiving their meals quickly and that they were also having social distancing opportunities. So we did purchase over 100 grab and go carts, like that first cart you saw on the first slide, where we put them in the schools and made additional serving lines. Also, we developed social distance signage so that the students knew where to stand and where to sit. You can see a little picture of that right there on the slide. We also implemented classroom feeding in over 40 schools, and we continued the grab and go for the distance learners in 90 schools. Next slide. And in an effort to reach as many students as we possibly can with our program, we did develop some different things that we've never had the opportunity to do before. The USDA had given us waivers where we could have the parents come in or the students take meals home, and we've never had that opportunity in the past. So we are now doing take-home snacks Monday through Friday at 123 of our schools. So as the kids leave, they pick up a snack and they go. Also at 115 schools, we have weekend meals. So on Friday, they take home breakfast, lunch, supper, and snack for both Saturdays and Sundays. And something also brand new is our Kids First mobile meals in Riviera Beach and also in Belglade. We have been able to deliver to homes of some selected students. So we've been delivering so far about 3,800 meals directly to their house. And then also you can see, this is a billboard that we have right now. You may have already seen it on 95 or the Turnpike. We have 8 of these and we have 25 bus with our marketing. The county, this came through the Palm Beach County grant that we received to promote our program, because the more kids that participate, the better for them, better for the families, and the better for our program. So we want to make sure everyone knows that we're serving free breakfast and lunch for every student every day at school, so no lunch box is required. So that's a marketing campaign that we're doing right now. Also, we'll be sending out some mailers, and we'll have some yard signs and banners up at the schools. Next slide, please. So the picture here is a family coming to pick up our meals. Since March, we have served 20,808,642 meals as of 2 days ago. And this was just a thank you. We did a School Lunch Hero Day, which we will be promoting again this year. And we hope everybody participates to thank our staff that's out there providing the meals. And I want to take just a special moment to thank them as well, because as much as everyone is doing in school food service, it's those frontline workers that are really making a difference and making this happen. And without them, we couldn't support our students and our families. So next slide. And now I would like to introduce Nancy Reese, the manager of Behavior and Mental Health, to share about counseling, psychological, and social services. Nancy?
Thanks so much. I feel so blessed to be a part of such a large group of like-minded people. It just warms my heart to hear everything that's being provided for our students and their families. So I just wanted to share my gratitude. The Department of Behavioral Mental Health was established in July of 2019. And since that time, we have been working to expand behavioral and mental health awareness and supports for students in order to enhance their social and emotional development, and which leads to their academic success. Slide. Go to the next slide, please. There we go. Within the department, there are 4 divisions that work together, as well as work collaboratively with many other departments within the district. We have the CAPE team. There are 4 teams that cover all schools that provide crisis assessment, prevention, and education and support for schools. We have psychological services, which includes 140 school-based school psychologists. The EPIC team, which supports the 170 school behavioral health professionals. The team provides training, support, consultation for those BHPs. But what I must say is that it is a two-way learning situation because of the depth of knowledge and experience of the BHPs. We have learned as much from them as they have learned from us. And I see that some BHPs are on the call, so I just want to give a shout out to you for the tremendous work that you've been doing. They have logged over 30,000 interventions at schools per month on average. So it's a tremendous amount of work that they're doing. And then we collaborate with 11 agencies in the community to provide mental health professionals, to provide individual counseling for students for free at 100 schools. Next slide. The department does a lot of work, but multiple people in our department provide different types of counseling and coaching for students. The classroom activities are based on the 5 SEL competencies. We do crisis response for students, professional development for everyone in the district, psychoeducational evaluations for struggling students, and we continually work to raise awareness of mental health and available resources to support mental wellness. Next slide. Dr. Busenik led the team to develop the Caring First website and service portal. And of course, the work was done by the Department of Educational Technology. And this this site was established again to remove barriers for students and families who are looking for services. You can find the site if you're in the school district. There's a portal tile that you can click on to go right to it. Or if you're from outside the district, you can go to the district homepage, scroll down to the bottom, and you'll see a heart that says Caring First, and click on that. It will take you right to this site. Next slide. To navigate the site, you can click on search, and there are 14 tiles that will appear, broad categories of services that you might be looking for. These are some examples: LGBTQ, families new to the USA, mental health and wellness. So you can also do an advanced search to enter a word for something in particular you're looking for and search, and you'll be linked to school, district, and community-based resources. It can be used across multiple devices, and it's mobile friendly. Within the Caring First site, there is a logging system that has been established for these work groups. And the reason we wanted to collect this information is so that we can get a better picture of what services are being provided at which schools and for which students. So we can look at what's really working best for the students. And Dr. Bernstein, you'll be happy to know that we are this week working on the pilot of having the information connected to EDW, so we can take a deeper look at the impact of the work on students. Next slide. Next slide. I'm going to skip that because I'm over. The other thing that we're doing is led by Dr. Francois is Mental Health Mondays. So there are messages every week on Facebook, Instagram, Twitter. You can follow those through the district communications. And then we'll be providing a mental health newsletter soon. Now it's my pleasure to introduce Kristen Rulison, the district's manager of social and emotional learning.
Good morning again, everyone. It is my honor to be able to share with you the work that we've been doing with SEL. So first, I'm just going to provide you with an update. Next slide, please, of some national trends that have happened with SEL across the last 6 months. The Collaborative for Academic and Social Emotional Learning, known as CASEL, has been making a shift to a more transformative approach of SEL. This past fall, they've updated their 5 SEL competencies to really bring in what they call equity elaborations. So their goal is to really work on using SEL as a lever to advance equity work, as well as create even more inclusive environments. So since we follow CASEL's the 5 SEL competencies as our framework for SEL as a community, this caused us as a community to then reflect on our current definition for SEL and think about what changes we might need to make. Next slide, please. So we're very fortunate in Palm Beach County to have the Birth to 22 Community Alliance. And one of the action teams of that group is an SEL action team. So at our Birth to 22 SEL action team meeting back in November, we came together and we made revisions to our definition to reflect how, as a nation, SEL was making shifts. So take a second and please read over this definition. And I would like to invite you to think about what SEL skills listed in this definition could directly impact having a positive and healthy social emotional climate. And then just type into the chat box any phrases that stand out to you. All right, we have some responses coming in. Managing emotions, that seems to be a big one, right? Empathy, attitude. Empathy is huge right now, right? Relationships. So we're seeing lots of different ways that SEL really supports this healthy social and emotional climate. Also, by having an opportunity to have you guys process the content and enter in the chat box, that's also honoring one of our other SEL signature practices, such as an engaging practice. I want to now, I kind of talked about SEL on the national lens, and as a community, now we're going to narrow and focus in on what we're doing as a district team with SEL. So this is my fabulous team, and I just want to quickly acknowledge all of them because I could not do any of this work without them. I always joke around that we are the small but mighty team. Next slide. So at the beginning of the year, we kind of thought about what is our vision for this year, to really think about what is the work that we want to do as a district for SEL. And a big aha moment for us last year was when the pandemic happened and schools went completely virtual in the spring. We were asked to produce SEL content through videos. And something we realized as a team is we never really had district-wide common language and almost like a pacing guide of suggested, you could go back, Paula, sorry, suggested themes for skills. So when we were picking back in the spring, the skills that we were going to do, we realized that, we could be picking skills that kids might have been focusing on all year. And how are we ensuring that we're really hitting all 5 of those competencies? So our goal for this year was really to build belonging for all students, knowing that they're transitioning back, some were staying virtual, some were coming to the classroom, while developing common language around SEL skills. Next slide, please. So this brought us to the creation of our school district's SEL guide, where we took CASEL's 5 SEL competencies and we identified common district SEL themes or skills that we wanted to ensure that we were focusing on district-wide to ensure that we were really supporting the whole child. So Kelly's going to drop in links if you haven't seen this document. Over on the right, it gives you a little example where, every week, and this is suggested, schools do not have to do this, But by having common language and common themes that we focus on at the same time, it allows us as a team to then provide resources to the district. So now let me share some of the resources that we've created. Next slide, please. So going back to like one of our goals was creating this sense of belonging for all students. So one way that we did that is we created morning meeting slide decks for all elementary schools. You'll see a sample of that over on the left-hand side for teachers to use. We've got lots of positive feedback around this, where we embed the SEL themes of the week into those slide decks, as well as we also use this as an opportunity for kids to get to know each other and do community building throughout the year. Then in secondary, down in the below right-hand corner, you will see that we provided welcoming rituals or check-in or built community building prompts for secondary schools to kind of use either through the announcements or designate a period of the day if they wanted to really engage students in reflecting on that SEL theme of the week and also getting to know each other and just spending some time in reflection. And thank you, Melanie. I'm glad to see that you use them and that you think they're amazing. Next slide. So then that was one layer, right? Building that sense of community and belonging for all students through morning meeting and SEL welcoming rituals in secondary. But we also recognize that we need to explicitly teach these SEL skills and strategies. So we created this year, to go with each week's SEL theme, district created SEL lessons, recognizing that there's so much on school's plate. We've tried to keep these 5 minutes or less. And there's quickly overview of here's the SEL theme of the week, definitions, non-examples, and then 3 to 4 tips of how they can apply this to their own life. And then there's always opportunities for students to discuss it with their class at the end. Next slide. So another thing that having SEL themes of the week, we're very fortunate to be housed in teaching and learning so that we can collaborate very closely with other content areas. So in collaboration with the curriculum department, we create, this is the themes for March. We've been creating different prompts that you can use to integrate the SEL themes into all academic areas. Next slide. And then recognizing that SEL is not just about students, but we also need to support our adults. And if they're taking responsibility for social emotional well-being of our students, they need to also feel that they are getting that as well. So we have started an adult SEL series where every month we do 30 minutes micro PD sessions on just, reflecting and strengthening our own adult SEL competencies. And you'll actually get a little glimpse of that in a minute when Kelly Sapp, one of our coaches, is going to do a little segment from that. And next slide. And just 2 more quick things. We are very excited, just as Castle is making that shift towards a more transformative SEL approach, we are too this summer, and we are kicking it off with our virtual SEL Summer Institute. Please save the date. Our theme for this summer is leveraging SEL for equity and inclusion. In the next month or 2, you will see registration information coming up. And last but not least, next slide. If you want to stay in the know of what's going on with SEL, you can email me. We do monthly newsletters to keep everybody up to date with the different SEL themes and resources and PD. Follow us on Twitter at SELPBC, at Kristen Rulson. And Kelly just dropped in our most current SEL newsletter for today, the first day of April. If you would like to get those, please email me and I'll add you to our distribution list. Thank you guys so much and have a wonderful day. And now I'm going to pass it over for our next component of health education to Pete Stewart.
Good morning, everyone. Thank you for giving us this opportunity to not only summarize, but to update you on what we've been doing as a part of health education. Of course, there are several departments that work with that component within our district, from Safe Schools to, SEL. Some of them you've already heard about, Eric Stern. So anyway, next slide, please. So this is our component on the wheel. Next slide, please. So as some of you may know, our grant has 4 main components, and that's our sexual health curriculum or human growth and development, our sexual health services, in which we work both with Dr. Smith as well as the healthcare district and the health department on delivering some services in schools. We also do safe and supportive environments, which focuses on our LGBTQ plus youth. And then we also do some surveillance, which includes our youth risk behavior survey and our school health profiles. Next slide. So our human growth and development curriculum is usually taught as the final unit of science. It's a part of the scope and sequence. It is required and was also put into the wellness policy as a component of health education. This year, of course, we've made some modifications. Well, last year as well, since we're taught in that last quarter, that last 9 weeks, it was done virtually. As of right now, it will be done virtually again, obviously, except for the students at our brick and mortar, they'll be there in person. We usually offer online professional development for our teachers, as well as in-person professional development. This year, that was synchronous, so it was in person, but it was also virtual. Our normal online component is asynchronous, so teachers can go on at their own pace. There are a couple of bills that may affect our human growth development curriculum, including Senate Bill 410, which would change human growth and development from being an opt-out or passive permission course to an opt-in or active permission course. So not lobbying, just educating, but keep your eye on those bills. Health education, we work with our health department to do some health education in various schools. We have a MOU to do that. We also work with our healthcare district. Obviously, our school nurses are a collaborative between the health department, the healthcare district, and the school board, and they deliver our sexual health services, including our 4 schools that have additional community partners right there on campus. Next slide, please. And then we also do our safe and supportive environments, which includes our We're All In campaign. Hopefully you've all had an opportunity to see our staff badges that identify teachers as an ally to our LGBTQ plus students on campus. We've also made a couple of modifications, of course, because of COVID. So we have done virtual GSA meetings. So those are our Genders and Sexuality Alliances for students in middle and high school. Many of those have gone virtual and have done some great projects. But the good thing about it being virtual is there's no travel time to attend those meetings. So I thank you to all of our board members who are completely supportive of this issue, but particularly Ms. Whitfield and Ms. Andrews have had an opportunity to attend some of those virtual GSA club meetings. We've also modified our Youth Empowerment Summit for this year and turned it into 2 meetings between our GSA club members and other LGBTQ students in the community. We did that in cooperation with Compass. We've had one already, and Ms. Whitfield and Dr. Fenoy were both able to be a part of that. We also worked with Miami-Dade and Broward County, as well as Equality Florida, on our annual All Together Now conference. This was our 7th annual conference, and we were lucky enough to have Ms. Andrews present as a member of the Florida School Boards Association. Ms. Ayala also presented, as well as Ms. Sagerholm presented a piece of our legal component. We also were able on February 25th to do Reading I Am Jazz Day. So that's we've done several of those opportunities throughout the year. And then, of course, surveillance. Many of you are familiar with our Youth Risk Behavior Survey, which normally would have been done in January. But as with many of our grant recipients, we moved that to the fall. So we will be administering the YRBS survey in the fall. So we will obviously have our results back a little bit later than usual. But we also are in the process of modifying our LGBTQ critical support guide. And we also have been able to add a We're All In tile to our portal for teachers, parents, and students. Provides a lot of great resources. So I feel like an auctioneer, but I believe I'm done. I'll certainly take any questions if there are any. If not, I believe I'm passing it back to Paula.
Thank you so much. Great first panel. And now we're moving to our self-care and compassion. Kelly Sapp.
Good morning, everyone. Again, my name is Kelly Sapp. Really honored and thrilled to be with you this morning. We had about 20-30 minutes of some rapid fire information, all amazing work being done both at the community and the district level. And I know, speaking for myself as well as my team and everyone in the district, we appreciate all the time and effort and energy that has gone into helping support the health and wellness of everyone here in Palm Beach County. But for the next 20-ish minutes, we are going to slow it down a little bit. And we're going to talk about how to help and manage our own stress through self-care and compassion. Slide, please. So, Dr. Alonso said that COVID was a huge disruptor of our everyday life. And something that we face every single day is stress. And stress can be good, it can be bad. But I want you to take a moment and think about, how do you manage stress? What do you do? Do you take some time for self-care? Do you walk? Do you take 3 deep breaths? What do you do for yourself to help manage your own daily disruptors of life? Feel free to drop it in the chat. You can unmute your mic if you're comfortable, but let me know, what do you do? Maybe you're taking some things from the slide on the screen. Someone says that they exercise, fantastic. Cheryl runs, awesome. Cheryl, that's great. Lisa says she treats herself to Starbucks, I love it. Gardening, lighting candles, deep breaths and walks. Taking dinner to the beach, awesome, how beautiful. Some sound healing, yeah, getting into that sensory part of your brain, taking walks every day. One of the things that I like to do is I take my sweet dog for a walk at the end of my workday, because it really helps me kind of recharge and take care of myself. So moving into the self-care part of our stress management, as you see here on the slide, the definition of what self-care is. There are lots of definitions of self-care, but one of the things that I really want us to focus on is, when we are looking at self-care, it's an activity that we do deliberately. It's what we do to take care of our mental, emotional, physical health and well-being. It's really a simple concept in theory, but when we actually take the time to think about what we do, how often do you practice self-care? And how can we as a community here in Palm Beach take the steps to take care of ourselves and then be able to help those around us? I liken it to the image of when we're on a airplane and you have to put the mask on yourself first, as they recommend, before you can help somebody else with their mask. We have all chosen careers of self-care in terms of being able to give to others. But if we're not taking care of ourselves, we're really unable to take care of those around us. So here on the next slide, we have some examples of what self-care and types of self-care that we can practice, whether it's the physical, like somebody said that they run for themselves, emotional, the social, maybe you meet out with a group of friends, maybe you take time with a loved one or a spouse or your children, maybe it's spiritual, maybe it's taking the time to attend church or temple, or however you practice your getting closer to how, your own spiritual practice. Dr. Alonso also said that the impact of COVID is financial as well. And so when we think about how we take care of ourselves, it's not always just necessarily for our physical well-being, but that financial sense of well-being can also truly impact how we function day to day. Here on the next slide, we have some examples for everyday strategies for self-care. I'm going to drop a link into the chat box, and we're not going to do this self-care work right now, but this is a guide for you to take a moment when you are feeling like you need a check-in to think about, what can you do to help yourself? Again, we're not going to take the time to do it right now, but this is a way for you to access that guide, to think about what can you do for yourself, that doing part of stress management, whether it's writing, thinking about what do I need in this moment. And when we talk about taking care of the caregiver, that really is you taking care of yourself. Oh, someone says that I need access. Absolutely. I'll grant everybody access as soon as we wrap up. a way to really take care of yourself, that idea of the mask, that visual representation, so you can then help others. Slide, please. So self-compassion. What does self-compassion mean? When we talk about stress management and we looked at self-care first, self-care is the doing. It's the actions that we take to help support and navigate our daily life so we can kind of manage those everyday disruptors that Dr. Alonso talked about. Self-care, or excuse me, self-compassion is really the way of thinking about how we treat ourselves and the love and compassion we grant ourselves. Having compassion for oneself is not very different than having compassion for others. It's a way to feel warmth and caring and taking the initiative to help ourselves in that moment and granting ourselves the same kindness and love that we innately want to grant to other people. You know, one of the things that when we talk about self-compassion in its relationship to stress management, as we begin the self-compassion process, it's easy for us to think about what self-compassion is and then build up our own practice and kind of strength in self-compassion so that it becomes a daily part of what you do every minute of every day. So some things that self-compassion is the idea of self-kindness, bringing to yourself an idea of warmth and intentionally treating yourself with understanding and grace and kindness. The idea of common humanity, so that you don't have to, especially during COVID now, we have all felt so isolated and so alone. That idea of common humanity, like we have quoted before, that we are all in this together, that in some ways we are all struggling on different levels, and that we are all fighting battles, be it big or small, that we can really help each other through these times of need and maybe discomfort and disruption. And then third, mindfulness. One of the key components of self-compassion is taking the time to be mindful. Where am I now in this moment? What can I do to help myself in this moment? How can I help support myself through these moments of struggle or discomfort or stress? Self-compassion is not self-pity, and it is certainly not self-indulgent. Oftentimes when I do this presentation for adults in the district community, people say, well, I can't do that because I really shouldn't be, I don't have time to practice my own self-compassion. I don't have time to do that. It's indulgent. It's something that I shouldn't be doing. And in fact, I would kind of nudge you to flip the script on that. In order to truly have compassion for yourself and to, again, put the mask on yourself first before you help others, it is imperative that we take care of ourselves, that we give ourselves that grace and that time and understanding to help manage those small daily disruptors in life, as well as kind of work through those large, huge, overwhelming disruptors like COVID has been for us, and other things that we encounter, whether it's death of a family member, a struggle at work, struggles at home. So when we think about self-compassion, it is truly a way for us to work through those daily, everyday stressors and disruptors and treat ourselves with grace and kindness and love and compassion. Next slide, please. Some everyday strategies for self-compassion is when you are having a difficult moment for yourself, pause and ask, what would I tell a friend to do? Or how would I treat a friend who was in that moment, the moment that I am in right now? And if you would do something different for yourself, ask yourself why. Why would I treat myself differently than I would treat any of my best, closest, dearest friends? How would I treat a coworker that is struggling? And as you process through what you would want to do to help or support them, give that back to yourself. Offer yourself that same kindness and compassion and care that you would give to yourself. And that's something that we call the self-compassion break. Taking the time to think about what can I do to care for and treat myself with compassion. Another idea is exploring self-compassion through writing, taking a moment to kind of chronicle and log those either daily disruptors or larger disruptors and struggles of your daily life, and taking account for what you are doing to actively practice your care and compassion. And then when things get bigger and start to feel more overwhelming, you can go back to that and rely on those strategies that have worked for you in difficult moments, and then apply that to the moment that you're in right now. The other thing is supportive touch. And I know in times of COVID, this seems so kind of distant and far away than it has before. And kind of those hugs that you get daily at work, maybe you're supporting children, high fives, knuckle bumps, those seem so far away that they did last year. But supportive touch in a way that you can really help yourself. Maybe it's taking the time to give yourself a hand massage. Maybe it's simply kind of like rolling your back and your shoulders, figuring out how to take the moment, 2-3 minutes, to really get back to yourself and nudge yourself into a place of support and kindness and compassion. So now, slide please. We're going to talk about, as Kristen said, one of the SEL strategies that we use as a signature practice is engaging strategies. So now I'd like for us to take a moment, and we're going to do an activity called Changing Your Critical Self-Talk. I'm going to drop a link into the chat that we can use later, but I'm going to guide you through this. This is the, again, Changing Your Critical Self-Talk link. And what I'd like for us to do is I'd like for you to take a moment, and I'd like for you to think about, what do you do in moments of struggle, disruption, or and what do you do when you're kind of down on yourself? Maybe you sent an email that was a reply all and it shouldn't have been a reply all. Maybe you made a snarky comment. Maybe you know that there is some struggle in the moment. And I'd like to invite you to take a deep breath and think about, how can you change that one piece of critical self-talk? What's your go-to? What's the piece, small thing that you tell yourself, that kind of inner voice that might not be so helpful in moments of disruption, discomfort? Patty's sharing that she prays for clarity and strength. One of the things that we can do to change our critical self-talk is to be in the moment. And so when there are times of struggle, discomfort, maybe it's 6 o'clock on a Wednesday night and all the kids are hungry and everybody's a little bit hangry, and that's my combination of hungry and angry, and everything's melting down. And I go in my head and I think, worst mom in the world, I'm losing it. I'm dropping the ball completely. Well, in order for me to change my critical self-talk, I need to take a moment. And I step back and I think, you've got this. It might not be the best moment in the world, but I can still get through this. Betsy's sharing that a breathing exercise, quiet space, and meditate. So as we think about combining self-talk with self-care and self-compassion, you can actively take time to avoid and break through those everyday disruptors, those everyday moments of stress and struggle, and really take into account what you can do to practice self-care. Thinking about, what do you need for yourself at that moment? What can I do to change and kind of flip my script of what I'm saying to myself to help me get through that moment? Allison shares that she's visualizing herself in a special place. Yeah, that kind of place of, that mental place of peace. Could be the beach, could be the forest, could be a trail. Greta is sharing repeat scriptures. Michael sharing breathing exercises and maybe music. What can you do to actively practice self-care, self-compassion in a way to manage not just the daily disruptors and stressors of life, but the larger kind of full-scale struggles of life? Next slide, please. I'm going to take a moment to first, before I hand it back to Paula, say thank you so much. I want you to, as we go through the rest of our time together, we're going to wrap up, but I'm going to give you a little bit of a challenge for our optimistic closure. But it was a pleasure being with you for the last almost 20 minutes. And I appreciate your time together and I wish you well. Don't forget to practice your self-care and compassion, and I'll see you soon. Paula, back to you.
Thanks, Kelly. Wow, I love it. And now we're moving to our second part of our whole school, whole community, whole child panel. And we will start with Vicki Alderman from Health Services. Hey, Vicki.
Hi, Paula. How are you?
How are you, sweetheart?
Great. Thank you. Good morning. This presentation is the result of the collaborative efforts of Health Services School District of Palm Beach County, the Healthcare District of Palm Beach County, and the Florida Department of Health. Next slide, please. Health Services is an integral component of the WISC model. The goal is to provide health-related services and information to students, their parents, and their guardians. Next slide. The school health program is a partnership between the school district, the healthcare district, and the Florida Department of Health of Palm Beach County. Healthcare and services are provided to more than 180,000 students in Palm Beach County schools. Next slide, please. Our mission is to foster the growth, development, and educational achievement of all students by prompting wellness and health in a safe and friendly environment. The health services component of the WISC model involves providing emergency care for illness or injury, prevention and control of communicable disease, and the promotion of a safe school environment. We achieve this through collaboration with our partners. All partners play an integral role in the delivery of basic health care to our students daily. Next slide, please. School health services maintain contracts with nursing agencies. These nurses provide services for all district schools, which include trainings to school staff, performing clinical assessments, and providing services to 2 school clinics serviced by the Exceptional Student Education Department. Next slide, please. Here are several areas of involvement by the health services team in alignment with the WISC model. A few of these are collaboration with the school health partners to implement COVID-19 reporting protocols and processes, coordination and training for first aid, CPR, and the AED, and outreach services, which resulted in the state of Florida Department of Health providing 180,000 facial masks. Next slide. The healthcare district provides services to 167 schools in the District of Palm Beach County. Over 50% of our students are on campus. Next slide, please. The healthcare district collaborates with the school district and the Florida Department of Health regarding the protocols for students with symptoms of COVID-19 while on campus. The teacher, school nurse, principal, and the Department of Health are involved with implementing and completing the COVID-19 protocols for students. Next slide. Along with conducting screening of students for symptoms, the school nurse has the ability to provide rapid testing at point of contact. There were 32,847 screenings from September 2020 to February 2021. 950 rapid tests were conducted from November 2020 to February 2021. The majority of these screenings and rapid tests occurred in the elementary schools. Next slide, please. The healthcare district nurses provide care for students with complex medical conditions. The nurses conduct screenings for hearing, vision, body mass index, and scoliosis. Among their many duties, they are also administering medications and consulting with students. Next slide, please. The Florida Department of Health works conjointly to develop local procedures for providing school health services to our students. Oversight for the statutory program requirements is provided by the school health director. COVID-19 guidelines are made available to all school health partners by the CDC and the Florida Department of Health. Next slide. Additional support provided by the Florida Department of Health ensured compliance with required immunizations for student registration by locating missing records, verifying health forms, and entering data into the student information system. Next slide. In accordance with the health education and health service component of the WISC model, the Department of Health school health staff provides support for the immunization program and for charter and comprehensive schools. The nurses in the comprehensive school health program perform the basic school health services required by Florida statute. In addition, they provide services to students to reduce the risky behaviors and promote access to counseling and health services. Next slide. By successfully working together with our partners, the school district of Palm Beach County is meeting the challenges of COVID-19 as we continue to provide for the health needs of students attending our district. Thank you. Our next WISC component is employee wellness, presented by Carly Fabricant, our wellness coordinator. Hi, Carly.
Hi, Vicki. Thank you. Slide. The goal of employee wellness is to promote the safety and the physical, social, behavioral, and emotional health of staff. Slide. Virtual wellness for the school district for our employees has been very successful. This is something that we're very thankful for. We have been able to engage more employees than ever with our programs because we can now reach the whole district, as opposed to if we were on site, we could only reach a segment of our population. We have had monthly challenges that focus on their physical and mental and financial health. And we have been able to engage about 100 to 500 employees through this method. We've had virtual workshops thanks to our partners. And this reach has increased from 25 to 30 on site to over 75 to 100 employees. So we've had a greater district reach thanks to these initiatives and are very grateful for that. We've also been able to provide motivating incentives virtually thanks to our partners' donations. We've had wonderful partner involvement, many of them who are on the call today, so we thank you all. One of our newest partnerships has been with Kaiser University Dietetics and Nutrition Services Department, and they had provided to us the dietetic interns. And so we've been able to have rotations of students since last summer to provide individual consultations for our employees, as well as workshops and cooking demos. And this has been a very successful part of our program, so we thank them for that partnership. We have also been able to collaborate with many departments within the WISC components. We have partners with Safe Schools on grants and increasing the relaxation rooms throughout our district at the schools. We have partnered with Teaching and Learning to promote the fitness challenges that Eileen mentioned earlier on this call, as well as work with Behavioral and Mental Health Department on our RISE initiative that I will speak about a little bit later during our award ceremony. And lastly, we have been able to get more relaxation rooms throughout the district. Our goal is to have a wellness room for our staff in every one of our schools, and we have been able to increase our numbers this year. So we are very grateful for our successes this year and hope that they continue next year. Slide.
Carly, I moved the slide, but yeah, there you go.
Okay, no problem. So this is our contact information if you have any questions for us. And now I'd like to introduce Fred Cahill for the employee wellness component.
Good morning, everyone. COVID affects everything in our life, as previous presenters have mentioned. Dr. Alonso mentioned life balance and balancing work with relaxation and play and trying to stay healthy. And for our students, the playgrounds are a big part of that. The state recognizes how important play is for the students because they require 20 minutes of recess every day for our elementary school students. Unfortunately, we've had to close our playgrounds. We close our playgrounds because it's impossible for us to have the children social distance with the numbers of kids that we have using the playgrounds and cycling through the playgrounds every day. For instance, and you elementary school principals know this very well, you could have on an hourly basis 1 to 2 full classes on each playground consecutively throughout the day. So, 8 to 10 changes, counting aftercare, for the playgrounds with 15 to 30 kids on the playgrounds. And the playgrounds are designed and structured to encourage socialization. So how could we, in good conscience during a pandemic, allow the kids on that playground? So in abundance of safety, we have closed our playgrounds. They've been closed since last March. They're going to stay closed to the end of the school year, and then we're hoping to open them up in the summer. So for your school-based people, make sure you have somebody, a responsible person, taking a look at those playgrounds as we near the end of the year. Make sure there's nothing that needs attention from maintenance, and have your custodians clean them. Slip, trip, and fall accidents, #1 cause of death at workplace throughout the nation, #1 cause of accidents here at the district, are up dramatically. Slip, trips, and falls are up higher than they've been in a long time. A lot of safety is awareness. So just want to make everybody aware to be extra cautious out there, pay attention to where you're walking, watch for those wet floor signs, watch for those Go-Gurts that have slipped off the kids' lunch tables in the cafeteria so you don't slip and fall, but there has been a dramatic increase in slip and fall accidents this year. Our AEDs and CPR, unfortunately, those face-to-face certification classes have been canceled. There are some online classes that Dr. Smith has up, and hopefully we'll be returning to those face-to-face classes to get your CRT teams and your people that need CPR and first aid training certification back again. The AEDs, COVID presented us with a lot of unforeseen problems. While the schools were vacant for such a long time, a lot of the AED batteries and pads had started to expire, and risk management spent a good portion of the summer, the safety techs going from school to school and checking those that had expired and those batteries that had gone dead and changing them, because we were expecting a very stressful school year, which we all know we're experiencing, and we wanted those AEDs to be ready to use just in case. As I mentioned previously, slip and fall accidents are up dramatically. State distractions seem to be nationally, not just at the school district. I believe automobile accidents nationally may also be up, but we're distracted. We've got a lot going on. Many of us have been impacted by COVID. Others, are constantly thinking about it. So keep your eye on the prize, which is going home in the same condition that you came to work. I'd like to introduce Lisa Toy. She's the Sustainability and Recycling Coordinator, and she's going to be addressing physical environment.
Thank you, Fred. Good morning, everyone. Next slide, please. I have the honor today of representing the physical environment component of the WSIC model. And the goal of the physical environment component is to provide a physical environment that meets or exceeds local and federal guidelines. Next slide, please. And this is a collaboration between several departments, including school police, environmental and conservation services department, maintenance and plant operations, and also transportation services. Next slide, please. The School District of Palm Beach County Police Department has made a great effort and collaboration to remain safe and in compliance with COVID-19 protocols. School police was the first in the area to switch from live and in-person swearing-in ceremonies to virtual live broadcasted ceremonies. The department designed COVID-19 masks to be worn with uniforms and held their annual Shop with Your School Cop virtually this past December. This is a program that provides children with the opportunity to purchase toys and other items while shopping with a police officer. And lastly, the school police assisted all food distribution sites to ensure safety and efficiency. Next slide, please. And from Environmental and Conservation Services regarding infectious disease responses, ECS developed the school district's infectious disease plan and chairs the district's infectious disease committee, which includes many district stakeholders. ECS also provides enhanced sanitizing services for infectious diseases, including COVID-19 incidents using contractors and consultants. And in addition to contracting enhanced sanitization services as necessary shifts in response to COVID-19, ECS also purchased infectious disease supplies, which included hand sanitizing dispensers, disinfecting wipes, hand sanitizer and sanitizing spray, non-touch thermometers, and COVID-related signage. Further, ECS purchased disinfecting equipment, electrostatic precipitators, air scrubbers, and personal protection equipment, PPE, including face masks and 95 respirators and gloves. And these supplies have been used to support schools and ancillary facilities as needed. ECS also conducts COVID-related product reviews to ensure that sanitizing products meet environmental safety regulations and standards. And further, ECS developed a document outlining the COVID sanitizing procedures and best management practices. Next slide, please. And in collaboration with ECS, the Maintenance and Plant Operations Department was able to provide the boots on the ground fight against COVID-19. These dedicated men and women were reporting to work in person day after day to make sure that the schools were up and running. Various steps have been taken to ensure the safety of students and staff, including wherever possible, the HVAC filters have been upgraded to MERV 13. Clorox 360 machines were purchased, 189 of them, and delivered to each school. And an e-learning class was developed to train the custodial staff. Reusable face masks were distributed to the custodial staff on an ongoing basis, and plexiglass partitions were installed throughout the schools and ancillary facilities. Safety signage was provided for each school, including signage for playground equipment. New custodial procedures were developed to ensure disinfecting, and a Clean Talk e-learning course provided the necessary instructions to custodial staff. 50 temporary custodians were hired to supplement school cleaning. Disinfecting wipes and disinfectants were provided to instructional staff with an e-learning course that provided instructions on how to use the new products. And the fight against COVID-19 is not over, as Dr. Alonso mentioned, and the Department of Maintenance and Plant Operations will continue to provide the expertise and labor necessary to keep our schools open, safe, and clean. Next slide, please. ECS shifted to offering online sustainability resources to support schools during COVID. This included a Google Classroom, which has been used to organize environmentally themed distance learning resources and ECS virtual trainings. The Google Classroom has been used to communicate program opportunities supporting school sustainability. ECS offered recycling consultations via Google Meet this year and is developing a new school website to connect teachers with resources, guides, nature guides, classroom activities, and recorded presentations. ECS also hosted the district's first green webinar series for teachers, featuring experts for each day's green topic during a week-long training event. Topics included, that is my dog, I don't know if anyone can hear, I apologize. So yes, topics included water conservation, the Florida Safe Routes to School program, K through 12 energy kits, recycling, and an interactive workshop called Sustainability in the Remote Classroom, which was hosted by one of our partners, EcoRise. And I just want to thank all of our partners. You can see on the flyer there, we had a lot of great partners that supported this initiative. And ECS is also partnering with Keep Palm Beach County Beautiful to purchase 1 to 2 water refill stations for several schools this year. MNPO is also supporting this initiative. And the refill stations aim to green our schools by reducing plastic waste while helping to prevent the spread of germs through touchless bottle fillers. And looking ahead to programming for next year, ECS was recently awarded a grant from the Florida Humanities to host a traveling museum exhibit from the Smithsonian next year called Waterways. The exhibit will provide students with a means to explore water from both scientific and cultural perspectives while offering virtual learning opportunities as well. Next slide, please. She wants to go outside. So she's letting me know that. And our last slide is from Transportation Services. Transportation provided safety protocols for staff and student ridership. They equipped 50 buses with Wi-Fi to increase connectivity in select neighborhoods as needed. They provided bus drivers and attendants training on station high touch areas on buses between routes. They also developed protocols for monthly sanitizing of all buses with electrostatic sprayers. They launched an app called Make Your Choice for parents and guardians regarding bus registration. And Transportation Services drivers, attendants, and staff volunteered with the school food services team to distribute over 200,000 boxes of food to students and their families in collaboration with local nonprofit partners. And our next component is family engagement, which will be presented by Javier Ortolaza, Guidance Services Specialist for the Department of Multicultural Education.
Thank you, Lisa. Thank you very much. My name is Javier Ortolaza, Guidance Service Specialist for the Multicultural Department. Our director is Francisco Oaxaca, and today we also have Elga Kanaip, our data processor from the Welcome Center, who will be presenting as well. Our goal is to encourage families to participate in the wellness initiative in our district to support students' physical, social, behavioral, and emotional well-being. Next slide. The slide you are looking at reflects the virtual family engagement nights events that were held throughout the 2020-21 school year. These events were done in English, Spanish, Haitian Creole, and Portuguese. Slide. Our Guatemala Mayan community also had the opportunity to participate. The Guatemala Mayan team of the Multicultural Department were able to bring pertinent topics where family asked questions regarding choice programs, Wi-Fi, technology challenges, and graduation requirements. It was a great experience to observe families fully engaged during these orientations. Slide. The migrant education program had a great turnout of parents participating in their events as well. Slide. Family that participated in the virtual family engagement events were encouraged to pick up a backpack with books and school supplies to use at home. Backpack distribution sites were set up throughout the district. Slide. We have also partnered with nonprofit organizations and faith-based communities to meet the needs of families that have been impacted by COVID-19. Slide. These organizations are Feeding South Florida, Caridad Center, the Giving Closet Project, the Immunization Van with the Health Department, Back to Basic, and faith-based communities. Slide. The Global Education Center of Palm Beach State College, TRIO, and Carmen Delgado, who is the representative of the Scholarship for Dreamers, supported students and families to complete the free application for student aid and the Dreamer Scholarship. Slide. Now we're going to have Elga to provide you with some information on how families are helped or assisted through the Welcome Center.
Good morning, everyone. Thank you, Javier. The Welcome Center welcomes families whose first language is not English. However, we support every family that comes to the center anyway. We help families with the registration process, grade level placement, counseling, and social services by our bilingual staff. We also collaborate with the Palm Beach County Health Department to schedule the immunization van in our facility. The center is currently open Tuesdays and Thursdays from 8 to 3:30 p.m. Families can feel free to call us at 561-434-8065 to make an appointment or talk to us for further assistance. These are all the services that we provide for families that visit the Welcome Center. Please feel free to share this information with our community. And thank you all for all your support. To continue with the presentations, I will leave you now with our next component, the community involvement with Brian Knowles and Patricia Trejo in the Teaching and Learning Division. Thank you all.
Peace and blessings, everybody. Good morning. Thank you all for this opportunity. Again, my name is Brian Knowles, and I represent the Office of African American, Latino, Holocaust, and Gender Studies within the Division of Department of Teaching and Learning. And I also have one of my amazing team members here, Patricia Trejo, who handles the Hispanic Latinos studies portion of our office. Next slide, please. So as far as the work, we have a very extensive title for our office, and within that title, we have some very critical and extensive work that we're responsible for in our school district, a school district of almost 180,000, 190,000 students, where a majority of those students, 64% of those students, are either children of African diaspora or students of Latino Hispanic descent. The overall goal of our office, is to reform teaching and learning by creating an educational foundation where all students are affirmed and validated. And as we know, we have an educational system, not just here in Palm Beach County, but throughout this nation, that is not always affirmed and validated certain students who come from historically marginalized groups. Those groups can include, but not limited to, students of the African diaspora, some of our students who come from Latin America or Latino Hispanic descent, also students of LGBTQ+ backgrounds, etc. This is also accomplished through the following steps. So we make sure that we normalize the teaching, the histories, and incorporating the culture and the values and perspectives of all of our students in the classroom. The way that we make sure that this is done, and I want to emphasize this, to make sure that the histories are normalized in the classroom, that they're taught beyond just the parameters of, for example, Black History Month or Hispanic Heritage Month. And some of the ways that we make sure that we talk about the normalization of teaching the histories of all the students in our classroom is that we work with the other subject areas within teaching and learning to infuse or integrate and transform the curriculum to all core subject areas to include the histories or aspects of all of our students' culture within the classroom. We're also responsible for the curriculum development and teacher support for 8 courses that are also available throughout all secondary schools, and that's African history, African American history, Latin American history, Holocaust studies, and also other courses such as Exploring Hip Hop as Literature, the great men and women of color who shaped our history, the history of Haiti, also African American history through the lens of visual arts and music. So we also work with some of our community partners, such as the Coalition of Black Student Achievement, Compass, Insight Through Education, Next Generation of Holocaust Survivors, and also individual unnamed and unaffiliated advocates who work on behalf of the community. Also, we work with curriculum transformation, where all students can develop an understanding of the experiences, perspectives of different racial, cultural, ethnic, religious, and gender groups. As it is critical that all students have an educational experience where they can see themselves in a positive light, it is equally as critical that students can see each other and understand each other's cultures and perspectives in a positive light as well. We're also here to support educators in implementing pedagogical strategies that address the cultural norms and learning preferences of a diverse student population. So we do on-site professional development. We also do community-facing professional development to engage our community and also our parent stakeholders. And there we also host 2 major events every summer. So mark your calendars for the week of June 28th for the Hispanic Latino Study Summer Institute, and also the African American and Caribbean Study Summer Institute, which will go live the week of June 28th. So as I say that, and that just kind of gives an overarching or overall summary of what our office does. And I just want to add that this has been something that's been a part of our school district for almost 27 years. So we're not new to the district, and we're not just, the conversations around equity and multiculturalism and inclusion is not just started. This is work that's being led throughout the school district, through our office since 1994. So with that being said, I want to bring in my amazing and fabulous team member, Patricia Trejo, to kind of expound on our community and collaboration with our Hispanic Latino community.
Gracias, Brian. I'm delighted to be here with you all. Well, we all know that the importance of community engagement has become pivotal, necessary, and viable now more than ever. So our team has continued to engage our communities because we believe that it will help us lead to more equitable outcomes that will enable us to better understand the needs and aspirations of our communities. Our team has been recognized by the Hispanic Chamber of Commerce with the 22nd Annual Triunfo Education Award for our ability to connect with our community. We are honored and we have continued to excel with having our business partners such as Supermercados El Bodegón, Don Ramon's Restaurant, and Circe, Denny's, Corolla, Barnhart, and Shipley, all of whom have been recognized by our school district and awarded the Bronze Award for their incredible support of our Hispanic Latino Studies initiatives. It has been through our amazing partnerships that we have been able to support our students through this unprecedented challenging time with scholarship funds, mentors, guest speakers, community service, and much needed job opportunities. In fact, most recently, we were able to secure a donation that will give El Sol Jupiter's Neighborhood Resource Center funds to be utilized for our most underserved, marginalized families. So when we have all of our hands on deck and we meet our communities where they're at, we are definitely stronger together, porque sí se puede. Thank you, and now to Kelly Sapp.
I want to say before Kelly, sí se puede. Patricia, you hit the nail on the head, and it does take all hands on deck working together to make our efforts. So I just wanted to say what a fabulous panel. And yes, Kelly, it's your next 2020.
Thank you, Paula and Patricia and Brian. It's time for a wellness break. So I invite you to, again, we're going to take 20 seconds to really just kind of check in, rest our eyes, rest our brains, and be ready for our last part. So pick something, either look out a window, something in your office, in your home, 20 feet away, and I'll count us down. All right, welcome back. 20 seconds of quiet and solitude and peace to reset your brain, refresh your eyes. And Paula, back to you, my friend.
Thank you, Kelly. And next, like I mentioned earlier, it's very exciting to have the ability to include our WISC efforts into the new strategic plan development. And I'd like to introduce Kathleen Villavicencio. Kathleen?
Hi, everyone. Thank you so much for the opportunity to share a little bit about our next strategic plan development today. I know Paula has graciously given us a great introduction at the beginning of the meeting. And Mrs. Whitfield also talked a little bit about the work that the board has undertaken around equity and how that will feed into our strategic plan development. And we've also talked a little bit about the survey that's currently going on. So I'm just going to dive right in for sake of time. So next slide, please. We do have a bunch of information available on our website right now. We're currently building out just the pages around the new strategic plan development as new kind of content becomes available as the process unfolds over the next 6 months. But I did want to quickly highlight what the timeline looks like. So, I guess it was yesterday, the month of March was really about reflection and just kind of pre-work about where we are and where we need to go. And that will continue into this month, the month of April. We currently have a survey that's open, launched on March 22nd and closes on April 9th. I know you saw perhaps at the beginning of the meeting, just kind of a QR code that you can scan with your phone and take the survey. It is open to students, parents, district employees, especially school-based staff, and our community members. So again, really hoping that folks will participate and will be able to spread the word just so that we get as much participation as possible. And then in May through July are really going to be focused on the development of the strategic plan. So using all the input that we collect and all of our lessons learned from our current strategic plan to put some draft goals forward. And then hopefully having a plan ready for school board approval in late July before the start of the next school year. Next slide, please. And so just want to leave you with, again, we're listening. Please, please, please participate in the phase 1 feedback survey. Again, there's the QR code that you can scan with your phone and just pull up the survey super quickly. You can also just go to palmbeachschools.org. It's one of the banners on our website. And please, again, encourage your networks to take the survey because we want to make sure we have a representative sample of folks in this first phase. We'll also be having focus groups to take place in late May and early June. There is a place on the survey for you to indicate your interest in participating in those, or you can also reach out to me at strategicplan@palmbeachschools.org if you have any questions or if you would like to be included in that phase 2 focus group. And then I will also be providing Paula with updates along the way so that this body can be kept up to date. In addition to, the board workshops that we do on a regular basis and all our steering committee meetings. So thank you so much again for the time. And with that, I will pass it back to Paula.
Thank you, Kathy. Okay, we are almost to the stretch and I'm excited to move into the award and recognition. So Carly, let's start with the Wellness Spotlight Awards.
Absolutely. Thank you, Paula. Our first award is our Wellness Spotlight Awards, sponsored by United Healthcare and the Education Foundation of Palm Beach County. The Wellness Spotlight Awards this year go to schools that apply because of their continued support and efforts for employee health and wellness. So this year we were able to award thus far awards to West Riviera Elementary, Lake Worth High, and Don Estrich High Tech Middle. The awards this year that we were able to grant to the schools is $500 worth of Red Apple supplies, $250 for a relaxation room, a garden, or hydration for the staff, as well as district-wide recognition. So here are some pictures of the award ceremonies on the campuses, as well as the beautiful room that was created at Don Estrich. We are very grateful for these schools for their efforts and continued support of their staff's health and wellness. Congratulations. Slide. Our next award is for the relaxation and wellness rooms. Because of our partners, we were able to grant several relaxation rooms to increase the number of rooms throughout the district. And as mentioned earlier, it is our goal to have relaxation rooms in every school so that staff have a place to go to unwind and relax. The awards, the relaxation rooms that were funded by Wells Fargo went to Belgrade Elementary, Gladeview Elementary, Highland Elementary, Lakeshore Middle, Pahokee Middle Senior High, Rolling Green Elementary, Royal Palm School, Village Academy, Pine Grove Elementary, Pioneer Park Elementary, and Pleasant City Elementary. Thanks to Fifth Third Bank, we were able to create rooms in UB Kinsey Palmview Elementary and Whispering Pines Elementary. Thanks to Horace Mann, we were able to create rooms in Park Vista Community High and Cross Point Elementary. And thanks to the Wellness Promotion Task Force funding, we are able to create rooms at Lake Worth Middle, Jacob Middle, South Intensive Transition, and Crystal Lakes Elementary. And these are some of the pictures that they have of the rooms that they have created thus far. Slide. And my last award is for our partnership with the Alliance for a Healthier Generation in their RISE pilot initiative. RISE is Resilience in School Environments, and we are piloting a program here in the district to improve adult SEL. And that way we can assist our employees. And then these practices can also translate into the classroom. So we are very grateful, thanks to the sponsorship of the Wellness Promotion Task Force, to create relaxation rooms and pilot this program at H.L. Watkins Middle, Plamosa School of the Arts, Palm Beach Central High, Tradewinds Middle, Meadow Park Elementary, Palm Beach Public, Everglades Elementary, Jupiter Elementary, and Gove Elementary. So congratulations to all the winners. We are very grateful for your support and your effort of this program. And now I'll pass it on to Michael Konusky from Safe Schools.
Hello, everyone. I am Michael Konusky with the Department of Safe Schools and School Climate Transformation Grant, Project Connect. And Project Connect is a 5-year grant focusing on integrating positive behavior support and social emotional learning with a concentrated effort on opioid prevention as well. We support 9 schools in the district in somewhat of a feeder pattern style. And as part of our grant, we wanted to focus on strengthening adult SEL and wellness at each of our schools. And so the idea of funding each of our schools with a wellness or relaxation room came about. These rooms are designed for faculty and staff to have a place to go throughout the day to unwind, recharge, and rejuvenate. And the 9 Project Connect schools that received this funding for the wellness room are Wellington Elementary, Wellington Landings Middle, and Wellington High School. And then Roosevelt Elementary, Coniston Middle, and Forest Hill High School. And then Hagen Road Elementary, Chris McAuliffe Middle, and Boynton Beach High. Slide. Here are some pictures of the some of our wellness rooms and at Wellington Landings Middle on the top left, and then Forest Hill High towards the center. Sorry about that. Purpose timing, right? And I saw in the chat box, somebody had said, you know, what is a wellness room? And this is kind of a picture of what that is. A wellness room is just a spot for staff members to go throughout the day, you know, on their breaks to just unwind, recharge, and just get ready for that second part of the day. And, you know, the importance of adult SEL and wellness, you know, can't be understated. You know, Kelly Sapp spoke to that earlier about adult, you know, wellness and SEL, and really has a big place in our district. And just noticing the Zen environment that was created in each of these rooms is just amazing. So shout out to them. And slide. With that being said, I'd like to introduce Janine Rizzo, Wellness Coordinator with School Food Services, to talk about the Garden of Dreams.
Thank you, Michael. Good morning, everyone. Happy Thursday. I'm really happy to be here. My name is Janine Rizzo, and I'm responsible for overseeing student wellness initiatives for the School Food Service Department. The Garden of Dreams program began in 2018 with Omni Middle and has continued to thrive since then. The intention of the program is to provide a green space for middle school students so they have a place to go to power down, recharge, regroup, and just be. In addition to the beautiful space for them to connect with nature, to support our district's SEL initiatives, students are introduced to different thinking modalities to help them expand their self-awareness, effectively manage their own behavior, and to provide tools and strategies to assist them with their decision-making process. Beginning in September and continuing through the end of the school year, students are introduced to different mindsets each month. Slide. While there are many mindsets to consider, the mindsets that were chosen for this program align with what is happening in our country during these months, because there's a high probability that students would encounter these mindsets off campus as well. Today's April 1st, and this month's mindset is resilience. If COVID has taught us anything, it's definitely how to persevere. Slide. Students are asked to create posters and slides that capture their interpretation of the mindset each month, which are shared with faculty and the student body. Slide. Some examples of their work are displayed in these 3 slides. This year, we collaborated with Kim Mazauskas from the Safe Schools Department to leverage the Safe School ambassadors at these schools. Students and faculty at each of the Garden of Dreams schools had the opportunity to participate in a 30-minute Google Meet presentation called Navigating Life. This presentation introduced students to their mind muscles and how to strengthen and leverage them. They were provided with everyday strategies to help them move through what is very often the challenging seas of middle school. Today, I'm thrilled to share with you that we have 5 middle schools participating in this program. As mentioned earlier, Omni Middle began in 2018, followed by H.L. Watkins Middle in 2019, which were both honored and recognized at previous Wellness Promotion Task Force meetings. As you can imagine, to successfully onboard a program like the Garden of Dreams, it takes extraordinary leadership and committed and passionate faculty members. I'm pleased to share that on February 14th, just before COVID sent us all home, under the leadership of Rachel Capitano, who just happens to be this year's Principal of the Year, Don Estridge High Tech Middle joined the select group of schools. Spearheading the program on her campus is Bonnie Benjamin from Student Services. Slide. This year, we were fortunate to receive funding for 2 additional schools. On February 4th, Dr. Enrique Vela, the principal at Woodlands Middle, onboarded the program, and Jeanette Alfaro, their drama teacher, along with Kayla Irby, their behavioral health professional, are spearheading the program there. Slide. And finally, last Friday, March 26th, Polo Park Middle, led by Principal Mike Aronson, unveiled the Garden of Dreams on his campus. Leading the charge there is Chelsea Solorzano, their behavioral health professional, and Brittany Carrick, their school counselor. In addition to strong leadership and passionate staff, community funding and support is necessary to make this program possible. So I want to take a moment to acknowledge and thank our community partners. Slide. A huge shout out goes to our garden benefactor, Keep Palm Beach County Beautiful. Lourdes Ferris, the executive director, has been a phenomenal community partner. It is her willingness to support green spaces and our schools that made the Garden of Dreams possible on all 5 campuses. Slide. Jeff Nurge from Native Choice Nursery and Janine Griffiths from Green Thumb are responsible for each of these beautiful garden designs and installations. Slide. Our very own Wellness Promotion Task Force is responsible for providing the digital display at Woodlands Middle, which allows students there to display their artwork campus-wide. Slide. And last, and certainly not least, I want to acknowledge my colleagues in the School Food Service Department. Without the support of my team, Nick Garidian and Tabab Delisser, and our director, Allison Monblow, our general manager, Maggie Prieto, and my supervisor, Jamie McCarthy, who leads the nutrition services team, none of this would be possible. These ladies continue to encourage and support me in ways that allow my visions to become realities. And for this, I will always be grateful. Together we thrive because we always keep kids first. And finally, I want to thank all of you for the opportunity to share our successes with you today. Next, presenting the Student Achievement Award, please welcome back Lisa Toy.
Thank you, Janine. All awesome stuff. The Environmental and Conservation Services Department is pleased to recognize the members of Surface 71 for going above and beyond to support green initiatives and cultivate environmental stewardship in district schools. Next slide, please. Surface 71 is a student-led nonprofit organization whose mission is to educate the community about water conservation and reduce single-use plastics in our daily lives. Together, these inspiring young women have fundraised to buy water refilling stations at 5 local schools, saved 56,000 plastic bottles in just 1 year, designed and built 3 art sculptures made out of marine debris, and organized more than 40 beach cleanups since 2017. Congratulations to Emily Berseno of Suncoast High School, Gemma Curry, Forest Hill Community High School, Marina Bartow, Coniston Middle School, and Krista Brochu, Alexander Dreyfus School of the Arts. Thank you all for your hard work over the years to create and maintain healthy learning environment in our schools. And Paula, I will pass it on to you for the giveaway questions and answers.
Okay, great. And now the prize giveaways, we have 6. So pay attention. You have the chat box to put your answers. Allison and I are going to do this together because Seth had to step out of the meeting. So next. The question is, what does WIS stand for?
Person to take in the chat will receive you to cry.
Okay, anyone who can,
There we go. Paula, we have one. Whole school, whole community, whole child, and that is Jamal Hayes. Congratulations.
okay, awesome. Next question. Allison, do you want to ask the question?
Yes, before we move on though, Paula, do we want to recognize the donors for each?
Oh, yes. So the one we just did with WISC, I want to thank Nancy Rees, our manager from the Department of Behavioral Health and Behavior and Mental Health, who was gracious to give an Amazon gift card, $25. So Jamal, we'll be mailing your gift card to you. Congratulations, Jamal.
Okay, and then the next question is, can you name 2 WISC components?
You have to actually type it on the chat, and it needs to be correctly put together. I see the winner, Sarah Palmer.
That's correct. Health services and social emotional climate.
Sarah, congratulations. You are receiving a gift from Humana. It's a water pick, water flosser, cordless plus, and it will be coming to you. If the winners can put their email or their addresses, but if you put your email, we'll contact you and we'll be mailing the gift to you. Next question is, what does SEL stand for? This gift is from Fifth Third Bank. Oh, wow. Who was the first one? Does anybody know? Okay, I got, many people got this, but I don't know who the winner is.
Well, it was Allison Joseph that got the first answer in there.
Allison, congratulations. I'm so excited. And Allison, you will be winning a Publix gift card for $25 from Fifth Third Bank. Allison, do you want to say the question?
Oh, yes. So the next is, what is the percentage rate of the population for vaccination to achieve herd mentality? And we already have an answer. Sally Smoller, congratulations.
Wow, congrats. Everybody was paying attention to Dr. Alonso. You guys don't even let me. Yay! So, yay! Okay, and this prize winner will be giving a prize from Humana, and it's going to be a Philips Sonicare Power Toothbrush for your great oral health. And thank you so much for picking 70, because that was really tricky. Now, the next question, Allison, do you want to say the question?
Yep. Please name one self-care or self-compassion strategy that was mentioned by Kelly Sapp. And Paula, we have a meditation.
Okay, and who's the winner?
Paula, is meditation one of the correct answers? I believe. Yes, yes. Kelly's saying yes, absolutely. I just don't have that on my list, Kelly. Sorry. So that was Alicia D.
Alicia D. Oh my gosh. Congratulations, Alicia. You are getting a prize from Care ATC, and it's going to be the Fitbit Flex 2, a fitness wristband, and we'll be mailing it to you. So go ahead and put your address or your email and we'll contact you. Thank you, Care ATC, for this gift. And the next question is getting harder and harder. But Allison, do you want to state the question?
Yep. How many years has the Wellness Initiative been taking place in the district? Lots of answers here. I do not see the correct one yet.
Between 1 and 20. Between 1
16. And who was that from? I don't see PBC BHC.
Who was that? Can you restate who is the winner for that?
It says PBC BHC. If you could let us
Alexa
know.
Lee, congratulations, Alexa.
Right.
This is a great gift from United Healthcare, and you're getting a special tote bag with lots of goodies and a $50 gift card. Woohoo! When am I gonna go to lunch with you, Alexa? All right, that's great. So next is just doing some closing remarks before we go to the optimistic closure, and then we have a special treat for the people that are staying on this meeting. Also, I want to mention that our Global Wellness Day is very near approaching us. It's going to be June 12th, 2021, and we will be sending information about this day, Global Wellness Day. In addition, I am so excited that we are almost at the end of this meeting and we didn't have that many hiccups. So congratulations. Our next meeting for, I'm not sure if it's going to be virtual or hybrid, whatever it is going to happen on October 14, 2021 in the hours of 8 a.m. to 11. And next, Kelly, take us out with the optimistic closure, and then you'll pass it back to me, Kelly.
I sure will. Thank you, everybody, for joining us for the last 2.5 hours. As Kristen mentioned, we like to use our signature practices, and the third of our 3 signature practices is an optimistic closure. So during my session, our time together, I asked you to think about something about self-care and compassion. And I'd like for you to think about that self-talk piece that we added. And I'd like for you to take a moment and write down the self-talk strategy or self-care strategy that you're going to employ for yourself. And I invite you to put it somewhere where you can see it and go back to it when you're having a difficult time, when things feel stressful or you're feeling struggling. If you'd like to drop into the chat the strategy that you plan on using, we welcome you to do that. Otherwise, keep that for yourself. And I hope you have a wonderful rest of your day and continue to practice self-care and compassion for your overall health and wellness. Paula, back to you.
So before I leave you with this special treat, oh my goodness, my phone is ringing. Sorry. I want to say that I want to thank everyone who played such an integral part in all the planning for this wellness promotion virtual meeting. The list of names is too large. However, you know who you are, and I thank you from the bottom of my heart. In addition, I want to give a special thank you to Frances Rosier, who keeps me focused, organized, and she is truly a gem. To Hillary Griever, who has always been there at after hours to edit our newsletters and send the message out to schools. To Denaro Milligan for all his IT support given for us to have a very successful meeting. To Robert Canan and Adam Fiveson for their magnificent artistry and designing talents. To Nellie Rivera, Trevor Thomas, and Mark Mary, who have supported us coming back to the headquarters building and get ready for this virtual meeting, and also for their constant, unconditional support throughout the years. And now we are one of the special treats before wishing you a happy Easter is joy. This is a special song that I want you to go out and spread joy to the world. Thank you so much.
Lately I've been real, watching the nightly news. Don't seem to find the rhythm, just wanna sing the blues. Feels like a song that never stops. Feels like it's never gonna. Gotta get that fire back in my bones before my heart turns into stone. So will somebody please pass the megaphone? I'll shout it on the count of 3. Singing to the sky, give me strength to raise my voice, let me testify. feels like it's never gonna. Gotta get that fire back in my bones before my heart turns into stone. So when somebody please pass the megaphone, I'll shout it on the count of three. In the pretty night, I'm singing to the sky. Give me strength to raise my voice, let me testify. In the pretty night, 'cause this is do or die. Time has come to make a choice, and I choose. Let it move, let it move, let it move. Yeah, I choose. Let it move you, let it move, let it move. Through the valley in the shadow of night, oh, with you by my side, I'm stepping into the light. I choose. Let it move you, let it move, let it move. Joy down in my heart to stay. I need that joy down in my heart to stay. Joy down in my heart to stay.
Thank you again for all you do and for all that you give. Keep giving more, and we'll see you in October. Thanks. Bye-bye. Happy Easter.